Well, they've been calling him names, questioning his judgment, even calling for his resignation. RFK Jr. there getting grilled on Capitol Hill. Good afternoon, everyone. I'm Kira Phillips, the Health and Human Services Secretary, tangling and many times shouting with senators from both parties in that fiery Senate hearing. Kennedy facing a lot of backlash over vaccine policy changes, turmoil at the CDC, including numerous contradictions in his public statements. All of this coming to a head after President Trump, as you know, fired CDC Director Dr. Susan Minares last week, just 29 days after she was confirmed by the Senate. And RFK Jr. supported that, by the way. And now Minares is claiming in the Wall Street Journal that she was told to pre-approve the recommendations of Kennedy's hand-picked vaccine advisory panel, which is full of vaccine skeptics. Kennedy has denied all her claims, and he did it during today's hearing. Here's a little bit of it.
This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her.
I'm a doctor. Vaccines work. Secretary Kennedy, in your confirmation hearings, you promised to uphold the highest standards for vaccines. Since then, I've grown deeply concerned. The public has seen measles outbreaks, leadership in the National Institute of Health questioning the use of mRNA vaccines, the recently confirmed director of Centers for Disease Control and Prevention fired. Americans don't know who to rely on.
Our Jay O'Brien joining me now from the Hill. He's been tracking the hearing throughout the entire day. I'll tell you what, this was pretty contentious, Jay.
Yeah, it really was. And there were some Republicans that surprised us with how pointed their questions were. We knew the Democrats would ask some tough questions of Secretary Kennedy in that exchange you played with Elizabeth Warren. That summed it up, really. But then there were Republicans who had sharp questions for him, too. Chief among them was Bill Cassidy, Republican senator of Louisiana, also a doctor. You'll remember, Kira, he was that key vote that really put Kennedy in the job as the Secretary of Health and Human Services. Other Republicans months ago, when Kennedy was going through the confirmation process, were looking to Cassidy to see what he would do. And today, Cassidy, after these shakeups at the CDC, this change to vaccine policy, all of these various things that Kennedy has done since taking that job, got a chance to ask Kennedy about his job performance so far. And he started by asking Kennedy if he believes, as Cassidy said he believes, that President Trump should get the Nobel Peace Prize for Operation Warp Speed, that operation during the pandemic that supercharged the vaccine rollout. Kennedy, not wanting to break with Trump, it seems, said that he does believe he deserves the Nobel Prize for that. And then Cassidy shot back. But you have been critical of these COVID vaccines. In some cases, you've pushed, I'm paraphrasing Cassidy here, misinformation about COVID vaccines, and they were off to the races from there. John Barrasso, the #2 Republican in the Senate, also a medical doctor, similarly had pointed questions for Kennedy about his vaccine policies. This was the most significant, not break to a sense, Kira, but most significant expression of concern, at least expression of questions that they don't yet have the answers to, of Republican senators toward Kennedy since he got into that job in Health and Human Services. It was a snapshot of where at least some in the Senate Republican Conference are on his job performance.
So, Jay, RFK said that the ousted CDC director was lying in that op-ed and also claimed that he fired her because she told him she was untrustworthy.
And that went over like a lead balloon with some Republican senators, Kira, I have to tell you. First and foremost, senators don't like confirming someone and then just a matter of weeks, if months, maybe, that person being ousted from the job, which is what happened with CDC Director Susan Minares. That's first and foremost. And also, there were some senators who said that that move led them to question Kennedy's capabilities of running Health and Human Services. Chief among them was Tom Tillis, Republican senator of North Carolina, who's not running running for re-election in the next time up, so he's free to speak his mind to a certain degree, who said that in his previous life, he told me he was a management consultant before he entered politics, and that decision to push out Susan Menorez led Tillis to question Kennedy's ability to manage the Department of Health and Human Services. Tillis also seemed to suggest that Kennedy was too fixated on certain ideologies to run that department in an effective way, and he said he still has questions, he still has concerns about Kennedy's nomination. They're not outright calling for him to be ousted, for him to resign the way the committee Democrats did today, but there were at least 3 Republican senators on that panel, which is a significant number when you think about Senate Republicans breaking with a Trump nominee who did express concerns.
Jay, I want to bring in our medical correspondent, also emergency room, Dr. Darian Sutton. So, Doc, what do you think today's testimony tells us about the direction of public health in this country right now?
Oh, Kira, confusion, concern, and a decreased trust. These are the key traits that we've been seeing that have been ongoing through these conversations. There is no doubt that there is a lot of confusion over what is beneficial, what is not beneficial. But what's important to understand here is that these are ideologies. The data has not changed in terms of the benefit of vaccines. That has been well validated and tested quite extensively, and arguably one of the most tested interventions that we have available in medicine. So now the question is, how can parents better make that decision with their providers without the backing of some institutions such as the CDC, while hoping on the benefits of advice from academies like the American Academy of Pediatrics and the American Medical Association, who dispute these claims coming out of these federal institutions.
All right, we'll continue to follow just what comes from the Hill there. Jay, I know you'll be chasing more interviews for us. Dr. Darian Sutton, thanks so much to you, too. Thanks, guys.